I'm Dr. Matthew Halpert, founder and CEO of Immunocine. I've spent most of my life in the space of cancer and cancer immunotherapy, and today I'm here to answer some of your questions. Go ahead and click on the different chapters below to get to your specific question, and let's discuss. For starters, we do have a very unique and personalized process. And so let's go ahead and discuss a few of the ways that our treatment differs from others that you may be researching at this time. We take your dendritic cells, which are the generals of the immune system army. It is their job to see a threat, identify it, digest it, and then communicate to the rest of your immune system what needs to happen. This is what happens when you get the flu. This is what happens when a bacteria enters your body, and this is what happens when you start to develop a cancer. It did not happen at this time, and so we're gonna fix that. We're gonna take your dendritic cells, we're going to take your cancer, and we're gonna take that cancer information, all of it, the entire genetic code, the entire protein library, everything that cancer is and or could be, and we're gonna properly reintroduce it to your dendritic cells in a very unique and specialized way. And when that happens, the dendritic cell is effectively reprogrammed. It now sees those cells as a threat, finally. When we reintroduce those cells, your cells, into your lymphatic system, it's going to go to work. It's going to communicate to the rest of your immune system what is happening and what needs to happen. And only at this time is your immune system going to wake up, get in the game, do its job. And now your best internal weapon is functioning correctly. The Immunocine Dendritic Cell Protocol is truly revolutionary and unique. So let me explain a couple of the things that differentiate us from others. For starters, we use a sample of your cancer to provide the target education. There are others out there that use peptides they've created or something that they've synthesized in the lab. And while those can be useful, they will not provide as much or as complete of an information profile as utilizing your own tumor tissue. Another difference is how we actually then load that information into the dendritic cells. So is Immunocine just another dendritic cell treatment, or are we truly different than the rest? And I'm here to tell you that we're as unique as they come. Here are a couple examples. Some other dendritic cell centers will try to race you through, and they'll tell you that they can get you multiple dendritic cell injections in the span of a week. Well, I've got some unfortunate news for you. That's not how your body works. That's not how the immune system was designed to function. Shoving multiple dendritic cell injections into a short time period does nothing for you except waste most of those dendritic cells. You need to follow proper immune kinetics if you want to get an actual robust and durable memory response. Other groups tell you that they can just get away with one dendritic cell injection. I'm going to again tell you that that's not how your body was designed to work, and you are going to be missing a variety, if not most, of the signals your body needs to generate a proper immune response. Most other centers will try and inject those dendritic cells as easily as possible, which often means IV or an intramuscular shot. Unfortunately, we've known for about 30 years that dendritic cells do not traffic well from the blood or the muscle and will not get to where they need to go, thus making most of these cells irrelevant. We actually take the time and effort to inject those cells right near proximal and uncompromised lymph nodes. We need to target your lymphatic system, which is where those dendritic cells are designed to communicate with the rest of the immune cells. And then finally, the way we load dendritic cells is uniquely different from everyone else and is the basis of all of our publications and FDA work. It is not enough to merely throw cancer markers at a dendritic cell. Whether those are proteins or peptides, mRNA, it doesn't really matter. If it's not loaded into the dendritic cell in this very precise overlapping way, you're going to be missing a majority of the signals that your immune system needs to see to properly activate and engage a target. When we take your cancer information, we effectively double load your dendritic cells, in which we put all of that cancer information simultaneously inside and onto the dendritic cell, allowing the dendritic cell to absorb that information in parallel, overlapping pathways, allowing it to see that information in a very specialized way, which then leads to the dendritic cell becoming uniquely activated in a complete and physiological manner, which your body can actually make use of. Another very unique aspect of Immunocine is the fact that we have our own dedicated, peer-reviewed research published in a variety of medical and scientific journals. Let me explain what that means. A lot of these centers and other groups will leverage academic publications to validate what they're doing. But if you look closely, those publications very rarely are from the centers themselves, from anyone on the team, and often not even actually about the science they're purporting to use. It can be very misleading. When we send you a list of publications, I personally am an author on most of them. We have our own science that has been robustly studied in the Texas Medical Center for the past 15 to 20 years, and we've published on it repeatedly. So to further clarify, the fact that we have a dozen or so of our own publications on our own science in these highly qualified journals, compared to many of these other centers which are simply leveraging other people's publications, should be a distinction as you do your due diligence research into us versus various other groups. Logistically, let's cover a few important details. Our treatment process from beginning to end is roughly 6 weeks. But to be clear, you do not need to spend all 6 weeks with us in Cancun. In the first week, you're going to come down and visit with our medical team. We're going to do baseline scans, blood work, consultations. We're going to check you out. We're going to go ahead and move forward with the biopsy, which is where we collect a sample of your cancer tissue that we can use. In week 2, you're off the hook, and we're doing the heavy lifting in our ISO 7 certified positive pressure clean room lab right here in Cancun. Your cancer is being broken down to its genetic components and its protein library, essentially all the information about what the cancer is or could be. We're going to take that cancer information we've extracted and we're going to load your dendritic cells in our unique, precise way. And that's when you need to go ahead and make sure you're in the area for your first injection. You're going to meet with our oncologist and you're going to have some more lab work. We're going to make sure everything still looks good to go. You're then going to receive your first dendritic cell injection. This will be an image-guided injection near your functional, non-compromised lymph nodes. For the next 2 weeks, whether you're on a beach in Cancun or you're back home, is somewhat irrelevant. Your immune system is now going to become engaged and is going to ramp up for roughly 12 to 14 days. This includes the dendritic cells reaching the lymph node, communicating to your T cells and natural killer cells, those cells then proliferating, which will probably cause lymph node swelling, and then moving out throughout your body to find the threat that they need to eliminate. At the end of those 2 weeks, normal immune kinetics says that this response might wane and drop a little bit. And that's why that is the proper time to hit you with a boost. So at roughly the end of week 4, you do need to be in Cancun for your blood work, oncological authorization, and your second dendritic cell injection. At this time, though the process is the same, when your body sees that second stimulation of dendritic cells, it is going to now move to a theoretical maximum plateau of what your immune system can be doing against this threat. And once again, you have a 2-week period off. For the next 2 weeks, your immune system is going to engage a higher level and is going to understand that this threat is serious and needs to be contained. For those 2 weeks, you again have the option to go home or to stay with us in Cancun. Finally, at the end of week 6, you will get your third and final dendritic cell injection. The process is the same, But our research has shown that this final injection helps a percentage of these immune cells convert into long-term, durable immune memory cells, which means that they will be longer lived and able to continue on this fight for a much longer period of time, regardless of where you go next. We choose to reframe the question because, in truth, what we see with our patients aren't actually side effects, but rather just effects. All we are doing is using your own immune cell, your own cancer, and reprogramming your body to actually engage the cancer and start fighting it. Therefore, the side effects all are effects of an active immune response, and they're necessary and often very important. For many patients, the symptoms will be minimal and within the realm of immune response, such as generalized fatigue, swollen lymph nodes, tumor-associated pain, low-grade fever, and headache. These symptoms will usually show up shortly after each dendritic cell injection, but they are short-lived and will usually dissipate as treatment goes along. People will often wonder, fairly, how one treatment can help so many different cancer patients. The answer has to do with the technology itself. Dendritic cells are able to absorb information from a target and then communicate to the immune system what it needs to attack. What that target is arguably irrelevant. The immune system is designed to survey and protect your entire body. Whether that's a prostate, a liver, a pancreas, or a lung is not necessarily important. Your immune system is supposed to protect it. Our technology focuses on how to deliver the target to the dendritic cells to be communicated to the rest of the immune system. If we can get a sample of your tumor tissue, then that's the target loaded into the system. We hope we've been able to answer several of your questions here, but we pride ourselves in being transparent and responsive. And if you have more questions that weren't properly or completely addressed, please do not hesitate to reach out to us.